Hello, my name is Dr. Mama Sankareh from the Gambia. I work in a teaching hospital, Edward Francis Small Teaching Hospital, as a medical doctor. I'm a resident in training for obstetric and gynecology. I studied sexual and reproductive health postgraduate diploma for 1 year under the program of Merck Foundation More Than a Mother. During the course of the study, some of the topics that was dealt with was fertility issues, sexual dysfunction, and other gynecological issue, and also a bit of embryology. Coming to the fertility issue, which is a great concern to us as gynecologists and obstetricians, it has been an issue worldwide. In my country, it's also an issue. So, with the fertility issue under the program of sexual and reproductive health, the course was dealt with in details compared to during the time of my medical program as a student. The course was detailed. The causes of infertility was also elaborated to us. Coming to my success during and after the program. During the program, it broadens my knowledge. As I mentioned earlier, that it was not, we were not taught in details as compared to the when I was doing it under the foundation, Merck Foundation. Also, as a medical professional, it widens my knowledge, it broadens my knowledge, and then my skills in diagnosing my patients. It also helped me under the during the course of my program. It also helped me to teach my colleagues about some of the topics that we were, or the topics that we were taught during the program. After the program, after completing my program, because it's a 1-year program, also I still continue teaching my program. Although I did not have any time I did not have any training program, but then I continue teaching my colleagues about some of the detailed topics that we were taught. Also, with my patients, it really helped me to easily diagnose some of the conditions that we were taught. Infertility, let me come to infertility, which is a very big concern to us. In my society, or as the society, in my society, let me say, infertility is termed as condition of only women. Like if a woman is infertile, it means the problem is the woman. But because of this training under the foundation of under Merck Foundation, it helps me to involve men when they come to our gynae clinic. Although we don't have a specific fertility clinic, but we see our patients both in fertility issues and then other gynecological conditions under one umbrella. That is our gynae clinic. But when it comes to infertility, it helps me to involve men because of the fact that during the course of my training, I was made to understand that infertility is not only caused by, it's not a problem caused by women, but also men. So it helps me to in the treatment of women. And also the sexual dysfunction, which some of my colleagues call me a sex therapist. Because of this foundation, or because of this course under the foundation of under Merck Foundation, it really helped me to come with ideas and then ways to counsel women with their spouses. It was a successful journey for me under this foundation. Again, one of the achievements that I got, which I'm very happy, because of this foundation, Merck Foundation, giving me the opportunity to study sexual and reproductive health diploma, I treated one couple who was infertile for almost 5 years. But because of the knowledge I got from the program, I treated that woman, and then currently the woman is pregnant. So this is a very big achievement that I got from my program, because we were taught of different the causes of infertility and the way you can investigate them, and then also the way you can start the treatment from treating infection to hormonal therapy to then other forms of treatment of infertility, like in vitro fertilization, intrauterine cytoplasmic sperm insemination, so all other things. Although we don't have those facilities in our country yet, like we don't have IVF centers. During the course of the training through the foundation, Merck Foundation, it helps me to widen my knowledge, my skills in counseling. And it has worked for so many women, which I am very happy. Okay, because of Merck Foundation, the benefit that I got from this program, this one-year program, I always advise my colleagues, if they have the opportunity, let them go and grab it, because it's very important. This course is very important, especially when it comes to women's health, reproductive and sexual life of women. It's very important. Let's talk about fertility. Still on fertility. Women are being stigmatized because they are infertile. Women are being they face violence in the community. They face violence at home just because they are infertile. So some of my patients who have issues with infertility, as I said, I counsel them. If I know that, I investigate them, because during the program, I made to realize that treating infertility is not only doing IVF or giving them medication. Even the counseling alone that is made during the course of during your clinic is important, because some of them, they are infertile or they don't have children, not because they are infertile, but then because of they have some psychological issue. But thanks to the foundation, or thanks to the program, the different counseling, the different ways of counseling that I got, the experience that I got, I start with counseling with my patients. I start with counseling. I tell them so many things with regards to only counseling. And some of them, when they do that, they are fine. So I involve the men because they need to know that infertility is not only caused by women. You can have male infertility or male fertility issues. So I got all those skills, all that knowledge, and the step that I should use not to offend the man, because in our society, in my society, it is very challenging to involve men in the fertility issue because of the concept that they have. Sometimes they will think that, no, I am not infertile, it's the woman that is infertile. But then, because of this program, it made me to have the knowledge and the way to make the man to be involved and then to understand the cause of infertility. That infertility can also be caused by can be caused by the men too. So I want to thank Merck Foundation for giving me the opportunity to go through this one-year program studying sexual and reproductive health. Thanks to Merck Foundation, thanks to the CEO, thanks to everybody involved in the study, the entire staff of Merck Foundation. So I say a big thank you to Merck Foundation. Thank you.